What if the real reason your blood sugar keeps climbing every morning has nothing to do with what you ate last night? Not the dinner, not the medication, not your willpower, but something happening quietly in the first hour after you wake up. If you are over 60 and living with type 2 diabetes, you know this frustration. You measure your portions carefully. You take your medication exactly as prescribed. You walk every morning. You avoid sugar, you do everything your doctor told you to do. And yet some mornings your glucose reads 140. Other mornings it jumps to 180. Same routine, same breakfast, completely different numbers. And every time that happens, a quiet fear creeps in. Is my body getting worse? Am I losing control? Will I need more medication? Will insulin be next? I am Dr. Javier Morales. For more than 2 decades, I have worked with adults over 60 who feel exhausted from trying so hard and still seeing their A1C slowly rise year after year. These are disciplined people, responsible people. They are not careless. They are not lazy. They are doing their best. But there is one foundational factor almost no one explains clearly enough. As we age, our first signal weakens. We can be mildly dehydrated and never feel thirsty. No dry mouth, no warning sign. Yet even mild dehydration can make your blood thicker, make glucose circulate less efficiently, and make insulin struggle to do its job. That subtle shift alone can push your blood sugar 10 to 15 points higher. 10 to 15 points may not sound dramatic, but over weeks and months that adds up. That is the difference between stable control and a rising A1C. That is the difference between confidence and constant anxiety every time you check your meter. Today, I'm going to show you how strategic hydration done at specific times in specific ways can help your body use insulin more effectively. Not replace your medication, not ignore medical care, but support your body so it works the way it was designed to work. Because sometimes the most powerful changes are not complicated. They are simply overlooked. I have seen this transform lives. And if you stay with me, you may begin to understand why your numbers have been fighting you and what you can do starting tomorrow morning. As we move past 60, blood sugar control becomes more complex even when your habits stay disciplined. First, your cells gradually become more resistant to insulin. That means insulin has to work harder to move glucose from your bloodstream into your cells. Second, your pancreas does not produce insulin as efficiently as it once did. You are working with less of a critical hormone at the exact time your body needs more support. Third, your kidneys do not clear excess glucose as effectively allowing sugar to remain in circulation longer. But there is one more change that almost no one talks about. Your thirst mechanism weakens with age. You can be dehydrated and never feel thirsty. Your mouth may feel normal. You may not notice any discomfort. Yet inside your body, your blood becomes slightly more concentrated. When blood volume drops, even a little glucose becomes more concentrated as well. Insulin must move through thicker blood to reach your cells. That small shift can raise fasting glucose 10 to 15 points. Now imagine that happening every single morning. Let me tell you about Richard. Richard was 69 when he first came to see me. He was organized, disciplined, and meticulous. He walked 3 miles every morning. He ate steel-cut oats for breakfast with measured portions. He took his metformin exactly on schedule. Yet his fasting glucose readings made no sense. One morning 145, next morning 182, then 168. Same dinner, same bedtime, same routine. He looked at me and said, "Doctor, I'm doing everything right. Why are my numbers all over the place?" So I asked him to walk me through his morning from the moment he opened his eyes. He woke at 6:30, checked his glucose immediately, made coffee, sat and read the news, ate breakfast around 7:30, took his medication with a small glass of water. I asked him one simple question. "When do you drink plain water?" He paused. "Usually not until later in the morning. I am not thirsty when I wake up." There it was. He had gone 8 hours sleeping without fluids, then another hour awake drinking only coffee, which can increase fluid loss. Nearly 9 hours without true hydration. Every morning his body was starting the day slightly dehydrated with cortisol naturally rising, pushing glucose into his bloodstream. It was not that Richard was careless. He was simply overlooking something foundational, and that is where our strategy began. Richard did not need a new medication. He did not need a stricter diet. He needed to change how he started his day. That is where the first 3 hydration strategies begin. Method 1. The morning reset glass. The most important hydration moment of your entire day is the first one, before coffee, before breakfast, before checking your phone. Within 5 minutes of waking up, drink 1 full glass of warm water, about 12 ounces. Not cold, not iced, warm or room temperature. Why is this so powerful? When you wake up, your stress hormone cortisol naturally rises. Cortisol tells your liver to release stored glucose into your bloodstream. This is one reason many people see higher morning numbers. If you begin the day dehydrated, that glucose becomes even more concentrated. Warm water, first thing, helps restore blood volume, improve circulation, and support insulin delivery, right at the moment your body is most vulnerable to a spike. When Richard began drinking warm water immediately after waking before touching his coffee, his fasting numbers began to stabilize within 2 weeks. Not perfect overnight, but consistent, and consistency reduces fear. Method 2. Add natural minerals. Water alone is helpful, but water with a small amount of natural mineral support is more effective. Add a tiny pinch of unrefined sea salt and a squeeze of fresh lemon to that first glass. As we age, electrolyte balance becomes more fragile. Sodium, potassium, and magnesium help your cells actually absorb and utilize the water you drink. Without minerals, some of that water simply passes through you. The lemon provides a mild acidity and vitamin C support, which may help reduce the intensity of your post-breakfast glucose response. The key word here is tiny. Just a small pinch. You are not making salt water. You are supporting cellular hydration. Method 3. Pre-meal hydration strategy. The next critical timing point is 15 minutes before lunch and dinner. Drink 1 small glass of room temperature water, about 6 to 8 ounces. Not during the meal, not immediately after, before. This prepares your digestive system. It stimulates enzyme activity and slightly dilutes stomach contents, which can slow how quickly carbohydrates enter your bloodstream. When glucose enters gradually, instead of all at once, insulin can keep up. That means smaller spikes and more predictable readings. Many of my patients report that this single habit alone reduces their post-meal numbers by 15 to 20 points. These first 3 methods are not complicated, but they target the exact moments when blood sugar tends to become unstable, and we are just getting started. By now, you can see a pattern. Blood sugar instability is not always about what you eat. It is often about how your internal environment supports insulin at critical moments throughout the day. Let us continue building that stability. Method 4. Hydrate. During physical activity, many adults over 60 walk daily garden, clean the house, or stay active in small but consistent ways. Physical activity is excellent for insulin sensitivity, but it also increases fluid loss through breathing and mild sweating, even if you do not feel drenched. If you wait until you finish your walk to drink water, you may already be mildly dehydrated. That can trigger unexpected glucose fluctuations after exercise. Instead, take small sips during activity. About 3 to 4 ounces every 15 to 20 minutes is enough. Not large gulps, just steady intake. This keeps blood volume stable and supports smooth glucose transport while your muscles are actively using sugar for energy. Several of my patients noticed that their post-walk readings became far more predictable once they stopped waiting until they were done to hydrate. Method 5. Avoid drinking large amounts at once. Some people go hours without water and then suddenly drink a large glass to catch up. Unfortunately, the body cannot absorb unlimited amounts instantly. On average, your system can effectively process about 1 cup every 15 minutes. Anything far beyond that tends to move quickly through the kidneys without fully hydrating your cells. Think of watering a plant. If you pour an entire bucket at once, most of it runs off. But if you water slowly and consistently, the soil absorbs what it needs. Your bloodstream works the same way. Spacing your water evenly across the day keeps circulation stable. Stable circulation supports stable glucose movement, and stable glucose movement reduces unpredictable spikes. Method 6. Temperature strategy. Temperature matters more than most people realize. Very cold water can cause temporary constriction of blood vessels. When vessels narrow, circulation becomes slightly less efficient. For someone already dealing with insulin resistance, that subtle change can matter. Room temperature or slightly warm water keeps blood vessels relaxed and open. That allows insulin to travel more freely and deliver glucose into cells more efficiently. This is especially important first thing in the morning and before meals when your body is actively managing rising glucose levels. None of these strategies are dramatic, but together they build a metabolic environment that works with you instead of against you. And we still have 3 more powerful elements to cover. We have covered how to stabilize your mornings, protect your meals, and support circulation throughout the day. Now let us strengthen what happens overnight and during stress, because that is where many people lose control without realizing it. Method 7. Evening magnesium. Support. Magnesium plays a critical role in insulin signaling. Without adequate magnesium, insulin cannot function efficiently at the cellular level. Unfortunately, many adults over 60 are mildly deficient. About 1 hour before bed, drink a glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate. This does 2 important things. First, magnesium helps muscles relax and supports deeper, more restorative sleep. Poor sleep increases stress hormones and worsens insulin resistance the next day. Second, magnesium helps stabilize overnight glucose patterns. Many people wake up with elevated readings not only because of cortisol, but also because their body lacked proper mineral support during the night. This small evening ritual creates a calmer metabolic environment while you sleep. Method 8. Align with your afternoon. Cortisol rise. Cortisol does not only rise in the morning, it often increases slightly again in the mid-afternoon, especially between 3 and 4 o'clock. If you are mildly dehydrated during that time, you may notice an unexplained glucose bump even without a large meal. A simple solution is to drink a small glass of water during the mid-afternoon, even if you are not thirsty. This supports circulation and reduces the impact of that hormonal shift. Many patients report fewer late-day fluctuations once they implement this timing. Method 9. Slow breathing. While hydrating stress alone can raise blood sugar, when you rush through your day, eat quickly, and drink water mindlessly, your nervous system stays in a heightened state. Each time you drink water, especially before meals, pause for 3 slow breaths. Inhale gently through your nose for 4 seconds. Exhale slowly for 6 seconds. This activates your parasympathetic nervous system, the part responsible for digestion and metabolic balance. Insulin works more effectively when your body is not in fight or flight mode. Now let me tell you about Helen. Helen was 75 and had lived with type 2 diabetes for 19 years. Her A1C had risen to 8.6. Her physician was beginning to discuss insulin therapy. She felt defeated. When I asked about her hydration, she admitted she drank only 3 or 4 small glasses of water daily. She rarely felt thirsty and disliked frequent trips to the bathroom. We implemented the full hydration strategy step by step. Morning reset, pre-meal water, consistent daily intake, evening magnesium. Within 6 weeks, her daily readings improved noticeably. After 3 months, her A1C dropped to 7.3. Under her physician's supervision, 1 medication was reduced, but what she emphasized most was not the number. She said, "I feel clear again. I have steady energy. I am not afraid every morning when I check my meter." Practical daily formula. Here is a simple guideline. Take your body weight in pounds and divide it by 2. That number represents approximately how many ounces of water you should aim for daily. Spread evenly across the day, not all at once. Use a reusable bottle. Keep it visible. Make hydration predictable, because predictable habits create predictable glucose patterns. Before you begin applying this strategy, I need to say something clearly and responsibly. This hydration framework is not a cure. It is not a replacement for medical treatment. It is not permission to stop your medication. If you are taking medication for diabetes, continue exactly as prescribed. If your numbers begin to improve, speak with your physician before making any adjustment. any medication change must be supervised by your healthcare provider. If you have kidney disease, heart conditions, or have been advised to restrict fluids, consult your doctor before increasing water intake. Hydration is powerful, but it must match your medical reality. If you take blood pressure, medication monitor how you feel. Proper hydration can lower blood pressure naturally. That is often beneficial, but dizziness or lightheadedness should always be reported. Now, I want to add something personal. In my professional experience, the patients who improve the most are not the ones who chase complicated solutions. They are the ones who consistently strengthen the basics. Over the years, I have become convinced that hydration is one of the most underestimated foundations in metabolic health. It does not create dramatic headlines. It does not sound impressive, but when applied strategically, it creates measurable change. That is my clinical observation after working with adults over 60 for more than 2 decades. I also want to clarify something about the stories you heard today. Richard and Helen represent real patterns I have seen repeatedly in practice. Their stories reflect common clinical experiences. Individual results always vary. Not everyone will see the same numbers, the same speed of improvement, or the same medication adjustments. These examples are educational illustrations, not guarantees. Now here is my challenge to you. Commit to 14 days. Follow the structure carefully. Warm mineral water immediately after waking, a small glass before lunch and dinner, steady hydration across the day, mid-afternoon support, magnesium before bed, slow breathing while you drink, track your fasting glucose, track your post-meal readings, write them down, expect adjustment during the first week. More bathroom visits are normal. By the second week, your body usually adapts. What you are looking for is stability, more predictable mornings, less dramatic spikes, steadier energy, clearer thinking. If you see improvement continue, make it part of your routine, because sometimes the difference between frustration and progress is not another restriction. It is giving your body the foundational support it has been missing. If this message resonated with you, share it with someone who feels discouraged about their numbers. Leave a comment and tell me whether you are committing to the 14-day challenge. Stability is built step by step, and sometimes the smallest strategic change creates the most meaningful shift.